think Mini presented the case of this Liga, and I would like her to repeat. Also, she's called Mini. I wouldn't say she's so mini. She's like lioness of homeopathy. And I'm really looking forward to see this case again.
Hi everyone. Nowadays, we see that there is one common disease of modern women. Nowadays, we see that the modern women are getting new set of diseases, and one of those diseases is endometrial hyperplasia, endometritis, and which is a kind of precancerous condition. And everybody who start getting symptoms of endometrial hyperplasia start getting this fear in their mind that someday they can get, the disease, the very fearful disease called cancer. So I have treated uh, 10, 11 cases of endometrial hyperplasia successfully. But there was one case which came across to me. This case was very typical in which the patient was taking the modern medicine previously, but with very poor results. And still the patient was suffering. And now the patient was advised that the patient should get the hysterectomy done, should get the uterus removed. So let us see uh, how the patient approached me and how I dealt with it with homeopathy. A 44-year-old female, G2P2L2A0, diagnosed with endometrial hyperplasia, came to me for treatment on 25th March in 2019. The presenting complaints was heaviness in chest. She told me, doctor, I have heaviness in chest, heaviness in abdomen, feels as if there's something is stuck in the chest. In the evening, the body ache rises, and the problem of continuous uterine bleeding in between the periods is there, which is now controlled with allopathic medicines. But her since then, her general health has deteriorated a lot due to heaviness in the body. She is unable to do anything properly. She feels so weak. She feels so deteriorated since last 2 years. And what I could see, and she told me she was very impulsive now, very hurried and worried in nature, and she hurries others too. Whenever she has to go to attend some meeting, she used to get very apprehensive, very anxious. Then we took the physical generals. I got to know her appetite is very less now. Thirst is increased. She has a dry mouth. She takes a sip of water every now and then. She likes to eat salty food, and she has aversion to sweet food because if whenever she eats sweets, she suffers with body ache rises, or she has some diarrhea. She had cravings for cold drinks. Her tongue was dry, cracked at the center with red tip, and she used to pass stool morning and evening, and she had increased urge to pass urine day and night, more at the night time, and also whenever she had to uh, leave for some place from house, she used to feel increased urge for urination and sweat. She could not list any specific uh, area of sweat that time. She told me her sleep is so disturbed due to urination and also due to constant thoughts. And she was so anxious that she has to rise, in the morning, early in the morning. She used to rise before the alarm many times. And she used to have dreams of dead relatives and temples, religious dreams, gardens. And she had fear of height. She had so, so much fear of height because she told me she just, she was living on rent. So she used to go to look for a new place to live. Whenever she used to go to a building with great height, she used to feel nauseous or some vertigo type feeling in her mind. And she used to fear water. She could not cross a bridge. If she has to cross a bridge, she used to again feel very awkward looking down at the water. She used to fear suffocation, can't bear the nose and face cover at all. This, how she got to know it? During the COVID time, when everybody had to wear this mask, put mask over the face, she could not because every time she used to put mask over the face, she used to feel a lot of suffocation. And mentally, what I could observe, she was very much panicked, anxious. She believed that she has some incurable disease and she cannot get better. And also because she was financially not very sound, and now she was advised hysterectomy. She wanted some solution, and she was not very sure of the future. And she used to plan a lot for the future because her financial conditions were not good at home, and she was planning a lot about children education. So this was her mental and physical condition when she approached me. She was already suffering from the disease, endometrial hyperplasia, from past 2 years, for which she was taking hormones, and not, her symptoms were not getting better, although the bleeding stopped after Trenexa and the hormone progesterone, but overall health was deteriorating. Now, after that, I asked for the family history. Father died of throat cancer. That's why she was anticipating she might get cancer. Mother had thyroid. Elder brother died in accident, so she had no support in life. And some important life events, she reported that she was a healthy lady, but since she started a business after leaving a very secure job, her business had no profit, no loss. She kept thinking, what next? And husband was not having a permanent job. So she started suffering with metorrhagia from that time, for which she started with the hormonal treatment with so many from so many allopathic doctors. She kept changing her gynec, but with no better results. So that time, first time when she came to my clinic, looking at her symptoms, I prescribed her Argentum nitricum 6. Argentum nitricum for the set of symptoms she presented on the mind and body level, and 6 potency because there was lot of pathology. She brought an ultrasound, which she did earlier, that too, 1 year back. It had lot of pathology. The endometrial thickness was so much, and there was a lot of pathology in the body. So I started with 6. So 6 potency thrice a day for a week. Then I told her to come back after 5, 6 days. So my indications to argentum nitricum was ailments from long continued mental exertion. He used to have congested headaches, pain with sense of expansion, better by tight bandaging. He used to have gastric complaints, belching on and off, metorrhagia, which used to increase after mental exertion. She had anxiety, she was fearful, apprehensive, fear of heights was there, frequent urge to pass urine before going out, and sleepless with disturbed mind and worries as she used to wake up before the alarm rings. And she had trembling in the legs, and she had pain in the back, which was better by pressure. So then after that, after a week, she came to me. She told me, doctor, in spite of taking all those hormones, my periods earlier were stopped, but now my periods have started since yesterday. And on 31st, she came on 31st, and now she told me that there is a lot of coughing with lot of dryness and irritation in throat, and there is a lot of hoarseness, dyspnea, which increases in the midnight and later on when she tries to sleep. And the burping was so loud that while she was talking to me, she was like this, she was doing like this and rubbing her chest. And there was severe pain in the lower abdomen, as if it is filled with some heavy iron like thing. Lower back had severe pain this time, which was better by she wanted somebody to keep, rubbing her back with hard pressure so that she can feel a little better. And mostly she had the most difficult part of the day was post midnight from 2 a.m. to 4 a.m. when she was uh, in severe pain and restlessness. And looking at the patient's face, I could see there was a noticeable huge swelling on the face, especially between the upper eyelids and eyebrows. We know that if the swelling, baggy swelling is there in the around the lower eyelid, we give APIS. We can think of APIS and confirm our symptoms. And if the swelling is there above the eyes, Calicab we can easily get into our mind, and she could not sleep due to headache. So my indicated medicine came out to be Calicab 30. Because she was having acuteness in the symptoms, she was very restless. So I gave her Calicab 30 in 100 ml of water in a bottle, and I told her to tap it 5 times and take a teaspoon 2 hourly because she was suffering a lot. And if she gets better, then she can increase the gap. So the patient took the medicine, 1 dose at my clinic, and when she went back, she took the next dose. And the same day, now patient calls me around 3 o'clock. She was there in my clinic around 12:30 in the afternoon, and she says, "Doctor, my pain has increased a lot, and it's just like a labor pain, as if I'm in labor and nobody is in the house. I'm very anxious. What should I do?" Then I said, "Wait, call somebody." And then after few minutes, she sent me this picture and she told me, "Doctor, something is coming out of my vagina." And I knew that she has a thick endometrium. And then the pains were like labor-like pains. Then I thought, if after taking this medicine, the pain has triggered and something is capable of opening the os, then I think taking more doses can help the patient. I told her to take more Kalika more frequently after every 10 minutes. Then after few more doses, she told me it's stuck, not coming out. I'm in severe pain. WhatsApp, she sent me this. Then this much big mass was delivered by the lady with a lot of labor pains in her house. Then I told her to keep that mass with her and send it for the examination in the lab. We sent it for histopathological investigation. And after passing it, she was relieved as somebody is relaxed and relieved after after delivering a child. All her complaints, dyspnea, her coughing, her tightness, her swelling in the body was much relieved after that. She delivered this mass and her pain totally vanished after it was out. Also, the heaviness she was feeling in the body was all replaced with very light feeling. Indications for Kalika was sweat, weakness, backache are the main symptoms. She was sweating on the back since she was having the back pain. Pains were worse during rest and lying down. She could not lie wherever at the night, whichever side she was taking, she was feeling pain. Her pain was increasing, and there was extreme irritability, bag-like swelling in the upper eyelids and eyebrows, asthma, weakness, extreme before and during menstruation, and the modalities like, better by hard pressure. So this was the ultrasonography she had in 2017, which reported that she had endometrial thickness 12.7 mm. And since then, she started taking hormones and her bleeding, Prenexa, which stops the bleeding, and all the progesterone hormones, and the bleeding was stopped. But when I started with my medicine, her periods came, and then now when we sent that mass for the histopathological examination, we got to know that it was not cancer. It was just progesterone affected endometrium due to hormone imbalance. So this way, as she was advised hysterectomy, this was a surgery without knife, and we could save her uterus also. Later on, she followed a healthy diet, healthy lifestyle, and now she was very much motivated after this incident that she could prevent her hysterectomy. She followed a healthy lifestyle, and this is how homeopathy can help people by stimulating the body's own defense mechanism. That body is able to get rid of the unwanted mass it wanted, unwanted mass it wanted to get rid of.
Thank you, Dr. Mehta. It was really impressive. I'm impressed again. And this is like from the book for the students. Very didactical case. I think there will be some comments and questions, but we will leave it on to the end.